The Disruptive Dozen is a rank-ordered list of 12 closed-to-market cutting-edge technologies that leading Mass General Brigham faculty feel will have the greatest impact on healthcare in the next 18 months. Number 4. Solving the problem of infection in total joint replacements. Total joint replacement is among the great success stories in modern medicine. Today, people with aging arthritic hips or knees are no longer relegated to decades of pain and reduced activity. With a fairly straightforward surgery, followed by physical therapy and rehabilitation, most patients can resume their normal lives within a few months. As populations age and seek to sustain active lifestyles, total joint replacements are becoming increasingly common. In the U.S. alone, there are over 1 million total joint replacements each year. For most joint replacement patients, the road post-surgery is mostly trouble-free. But for roughly 2% of patients, the journey is much more complicated. That's because bacterial infections bloom within the artificial joints, and as a result, the infected implants must be removed. These patients must endure multiple surgeries, new joint implants, and long, painful recoveries. In the U.S. alone, the cost of such complex cases is some $1.6 billion a year. Now, a new technology pioneered by researchers in Massachusetts could help solve this problem. The innovation enables the delivery of antibiotics using the artificial joint itself by loading the drugs onto the synthetic materials used to engineer the implants, all without compromising the implant's structural integrity. This drug-eluting joint implant technology promises to help eliminate acute infections and could also reduce the need for multiple surgeries, thereby ushering in a new era of infection-free total joint replacement.
Infection is a major problem in total joints. About 2% of the 1 million joint surgeries that happen in the United States become infected. And to treat those patients, it costs about $1.6 billion in the US alone. And the mortality rate is comparable to certain types of cancer. We have come up with an innovative solution by modifying the permanent implants to minimize bacterial adhesion. We discovered methods to do this by adding certain therapeutic agents to these permanent implants, and these implants then elute these therapeutic agents into the joint space. Our ultimate goal is to eliminate infection by treating everyone with these modified implants. We're planning a stepwise introduction by starting with modifying the current gold standard treatment of infected patients who are operated on twice, unfortunately. Once to replace the infected implants with a spacer, and a second time to replace the spacer with permanent implants. This is now associated with super high mortality and morbidity. Our spacer, on the other hand, provides protection from bacteria while still maintaining function similar to permanent implants. Current spacer solutions only do one or the other of these functions so far. Next, we hope to reduce the 2 surgeries to 1, where the infected implants are replaced with permanent implants that also contain and elute therapeutic agents. After that, the use of these can be extended to non-infected patients that are high risk for infection in both the primary and revision settings. Finally, once we demonstrate the safety of these novel implants, we can recommend their prophylactic use for every primary and revision surgery.